I'm Jessebel Mae V.Rojas, your student nurse from FINMA Education. And for today's video, I'm gonna assessing the integumentary system of the patient. So the first step would be identify the patient. So hi ma'am, I'm Jessebel Mae V.Rojas, your student nurse for today. And what is your name, ma'am?
My name is Jessebel Mae.
Your age?
19 years old.
And then the next step would be explain the purpose of the respiratory system examination and answer any questions to the patient. So I'm going to explain what is the respiratory examination now. So a respiratory examination is performed as part of a physical examination in response to respiratory symptoms such as shortness of breath, cough, or chest pain. It can detect respiratory problems before it become emergencies. So the next one would be perform hand hygiene. So I'm gonna perform the hand hygiene first, ma'am. I'll be back soon. So I'm done performing the hand hygiene, ma'am. So the next step would be inspect the overall skin coloration. So the patient's skin is normal. And then the next one is inspect skin for vascularity, bleeding, or bruising. So there is no bleeding and bruising in her skin. Then the next one would be inspect the skin for lesion. So note bruises, scratches, cuts, insect bite, and wounds. If present, note size, shape, color, exudates, and distribution or pattern. That's done. Then the next will be palpate the skin using the back of your hands to assess the temperature. Wear gloves when palpitating any potentially open area of the skin. So this is the back hands. Down. So her temperature is normal. So the next step would be palpate for texture and moisture. So the texture and moisture is normal. And then the next step would be assess the skin turgor by gently pinching the skin under clavicle. Chin up, ma'am. It's good. And then the next one would be palpate for edema, which is characterized by swelling without and shiny skin over the edematous area. That's good. And then next one is if lesion are present, put on gloves and palpate the lesion. So since the lesion is not present, let's go on to the next step. So inspect the nail angle, noting if any clubbing is present as well as the shape and color of the nails. Okay, it's normal. And then the next one would be palpate the nail for texture and capillary refill. So her nails are normal, the color and the shape is normal. So the next step would be inspect the hair and scalp, wear gloves for palpation if lesion or infestation is expected or if hygiene is poor. So everything is good. And then the next step would be perform the hand washing. So after performing the hand hygiene, the last step would be document the findings of the assessment.